don't know how powerful your voice is. They don't want to hear another legislator. They don't want to hear somebody else that's advocating. Sometimes they just want to hear that personal story.
The only way to stop asbestos-related cancers is to ban it.
About 40,000 Americans die every year of asbestos-caused diseases.
Next is Henry Anderson, who also goes by Andy. He hails from the all-important state of Wisconsin. Always important state, I should say, of Wisconsin. He's an occupational medicine physician. He was chief medical officer in Wisconsin for years, including in charge of occupational environmental epidemiology. But what I associate him most with is he was one of the first really to show epidemiologically that families of asbestos workers were at risk for asbestos-related disease, publishing that in the 1970s from his time at Mount Sinai. And that was very important to show that above and beyond the immediate risk that workers had to asbestos and developing fibrosis, scarring, and cancer, family members were also at risk. So let me turn it over to Andy.
Thanks, Steve. What I want to begin with is the asbestos triangle, and that is at the top of the triangle there's a small group of people who were the miners that generated the products that we're concerned about now. But the real problem with asbestos is that it really was widely used. So you go down then to the processors, who are the factory workers. And if you think in terms of how we investigate environmental issues or occupational issues, we typically begin with the most heavily exposed individuals, who tend to be occupationally exposed individuals. So on the public health side, when we're looking for unusual diseases or sentinel diseases, we really look at what's going on in various industries. And as new industries come along, that's where we begin to do some surveillance to look at what kind of diseases are occurring. And as you move down, then you have the product users, primary being insulators and brake repair and para-occupational bystanders. Again, this is an inhalational issue. So if you're nearby somebody breathing the same air as they are, they may be protected. However, if you're standing next to them with a different job category, you're not necessarily protected. And then as we get down, larger and larger numbers who are in the maintenance sort of activities where these products have been installed, and then household contacts, as well as consumer products and other things. So the problem is, as we go down the triangle, the number of individuals increases, exposures tend to be somewhat less, and it becomes more problematic to try to differentiate what kind of disease is occurring in the group. From an environmental public health standpoint, there's critical keys to the future of how do we gather this kind of information. Right now we're in an informational decade where we can link large databases. For those of you who know medical records things, you have EPIC Systems, which is headquartered just outside of Madison, who have, after much pressure, allowed individuals to analyze all their medical data that they've gathered on individuals. And you have these humongous size databases that can be mined for information. Of course, it's only as good as what's been recorded in the data systems. And I'll show some of that information, not from them, but from earlier work. We've heard about this, and I just would remind you of, look at the one on the right there. After the spraying of the infrastructure in a building, it's kind of, how do you take care of that? How do you remove all of that? And what do you do about it? And of course, you saw from Dick, it took quite a while. We recognized this was a hazardous circumstance, not just for the workers, but everybody then within the building. Buildings tend to be renovated as you go, and it becomes problematic. So one of the things is you now have a lot of people working in those buildings who are maintaining them, who are remodeling them. Again, as we go from older buildings, like in University of Wisconsin, we now have to have all of these buildings wired for for computers, all of the old buildings. And if it was sprayed, you all typically have a suspended ceiling. And how do you suspend that ceiling? You have to scrape off what's covering it to make the anchors you put in hold the ceiling up. And so you have a whole nother workforce that one may be doing repairs or maybe installing these, but they're really not trained. They just know this is going to fall down if I can't screw it on tight. So you scrape everything off. And then as you have trucks go by outside the building, people moving around, every time the HVAC starts up, there's vibration, and gradually things fall down on top of the suspended ceiling. The issue is nobody sees that. So in a building where you're, like in a lot of the schools, you have a problem with deferred maintenance. So this is going on. The workers that do wiring and go up to take care of leaks and things like that go above the ceilings, and they see all of the stuff that's fallen down, but there's just a fine dust may come down, and some of the teachers may then complain that, geez, I got to dust my desk all the time, everything, all my books are all covered with this fine powder, and that's, nobody realizes what kind of exposures are occurring. So I'm going to give you a lot of really old data. Typically, when us scientists come and present, we want to have the latest information, all things that are new. I'm going to go back to some of the early work that I did, and you can see this is looking at mesotheliomas in Wisconsin from 1959 to 89. That really wasn't in an electronic data system. We had the records, and so we looked at all of the death certificates, and what happens over the years has been that all of that then gets coded. So you got a different set of employees that look at the words and say, oh, geez, what's that? What's a mesothelioma? Well, that's a cancer. So you go into the cancers, say, well, where is it? Or in the lungs. So a lot of early mesotheliomas got coded as lung cancer. If you look at the death certificate, it may describe something more, but those words are lost. So that now we're getting into the electronics and the data systems that can auto-code a lot of things. So one of the big issues that I fought for many years in Wisconsin was on the death certificates listed occupation and industry. Typically, as you went through it, it was expensive to get that coded. And if you think as COVID, when it came around, getting the record systems to put in what kind of work with individuals who were developing COVID, what they did, there were only three or four codes. One is it a healthcare worker? Was it a response individual? But all the other industries, such as the pork industry and workers in various facilities and chicken cleaning and things like that, those didn't get coded right away. So we really didn't recognize what were the risk factors for a lot of these things. But as you can see here, this is just one of our tables that we did, and you got a little stars there. You'll see the maintenance workers there. There were 33 males and one female death between 59 and 89. And then we singled out that there were school maintenance workers, of which we had 11. So when you think of the spraying of the buildings and the workers that are in there, these are maintenance workers who were going above, so it made sense that they would have been exposed. And there's a lot of buildings that have been sprayed or were using insulation materials that the workers would come into contact with. And then again, for those of you who went to some of these schools and you go into the gymnasium, they would have a sprayed ceiling, and you wonder, why are these all little pockmarks up there? What do the students do? You want to, if you're tall, you jump up and you punch your name into this soft asbestos, or you hit tennis balls up there and everybody stands around and laughs except for the maintenance workers who come along and they have to clean it up, brush it all up. So what's been seen in issues in those schools are the maintenance. And so we had schools that we were concerned about. Then you see down here, we have 13 teachers who developed disease. Well, for those in the legal business, you'd say there's lots of things that teachers do if they don't work all year. So they may have had a construction job or something, and they weren't exposed at the school. So you go back and you interview these individuals, and this is one of the first papers we did to look at to say, did they ever have any other identified source of exposure to asbestos? So you can see relatively small numbers. You can see shipyard workers, the top of the pyramid, and the asbestos insulators. We had only 7 deaths in that period of time. So then you may, for those of you who are around, there's the AHERA regulations that required all schools to be inspected for asbestos. They created whether it was friable asbestos, whether it was in poor repair, and as you see above the ceilings. And of course, my program was in charge of pulling that data together and looking at it. All of the buildings were expected. They had to have a plan of how they were going to manage this. And you might ask, so what's happened to that? This is data from 1989. That's 35 years ago. Most of those buildings are still there. And they're all new workers. Different workers have been there. So the problem is we begin these programs, you gather great data, everybody assumes problem solved. And that's a major problem as we go through. You can see also the differences between the public schools and our private school districts. You can see the private schools who tended to have more funds to handle maintenance and take care of this and do removals tended to be a little newer buildings than the old buildings. But you can see here on thermal insulation surfacing materials, 17% or 19% had friable surfacing material in the public schools versus 12% in the private. And you can see here quite a difference between the two, but all of them had problems that they then had to have a plan in place. So now this is additional information on cause of death on national death certificates. And this again is older data from 1990 to 1999. And here you can see 842 CIC code, elementary and secondary schools. There you have 53 asbestosis deaths amongst individuals in schools. Now, this isn't broken out nationally because of the coding. This would include some maintenance workers and others in the school. But again, it's kind of a alarm signal that maybe there's something going on that we ought to be looking into. But again, there's lots of information nationally, and this is asbestosis. So our most recent work we published 3 years after I retired, got the staff to pull it all together and do some fairly sophisticated analyses on it. And here you can see where I have the little stars, and I'm going to talk briefly about paper manufacturing. Well, everybody thinks, oh, they must be making asbestos paper. No. So I'll talk a little bit about the issue there. But here you can see 59 cases there of paper manufacturing industry. And then as you go down, you'll see primary, secondary, special education. Now the numbers from 13 is up to 49. Now, of course, the first was the first 30 years in Wisconsin. And now we move on further up. And so there's considerably more cases have occurred. So this is not an issue that's going away. So you heard about sentinel cases, and one of the kind of fun things that public health does is I was in charge of a state with 6.3 million people. And frequently people will talk about, a risk of 1 in a million. Well, 1 in a million in Wisconsin is 6 individuals every year, 1 in a million sorts of things. So you have an opportunity to have rare events occur, and then look into them. Typically, that as a start, and again, we heard briefly about vinyl chloride, that began with some physicians seeing 3 unusual cases of a cancer, which they then reported on, and that led to further investigation. So that's one of the things in public health, is you have these opportunities to do case reports and look at things. Same kind of thing began recently in the manufactured silica product for countertops and things. It's manufactured handmade stone that workers developed acute silicosis. And that, again, was individual cases being found. In Wisconsin, they came to light first through young transplant patients in the hospital. But again, when I first came to Wisconsin, pneumoconiosis was an issue, and there were very few certified individual physicians in the state, so we began a consultation program. It's very challenging to get doctors to report. Nobody wants to report to the government because that'll result in somebody investigating what you did and looking into it. So we provided a service to the physicians to say, if you see somebody that has chest x-ray abnormalities that appear to be fibrosis, don't just say fibrosis, ask them what they do for a living. And if you think it might be asbestosis or silicosis, send the x-rays, we'll give you a free reading. And oh, by the way, if you want a free interpretation, consultation, here's a form you have to fill out that gives a good occupational history on the individuals. So we began providing that service in the state. We began in 1985, and by the time I left, we'd received 5,200 x-rays to provide advice on and help with. And in April of 86, we had a painter from a paper mill with asbestosis. And then the subsequent year, we had an electrician from the same paper mill that came in. And we said, oh, gee, that's curious. We've been to look at the literature. And yeah, there were other cases of things happening in paper mills. And Wisconsin is a big paper manufacturing state. And so we went to the company and we said, you may have a problem. We knew the doctors that had reported this to us, worked with the paper mill. We then looked through our data systems and we found that there were mesotheliomas that had paper manufacturing jobs as well. You can see here beginning in 65 to 69 and going up to 1989, the numbers of mesotheliomas that are occurring. And you might say, what were the changes that all of a sudden led to big spike in the number of mesotheliomas? Well, cost savings in many of the paper mills was the faster you can have the paper come out, the easier it is, or the less costly it is to manufacture. So to make paper come out fast, they have to dry the paper faster. So they put in big ovens. So as the paper came out to go on the big rolls that you've seen, it would go through a dryer. And of course, the dryer had an increased heat over the time, so the paper could go by very quickly. And it turned out that they had purchased dryers to add to their paper rolling machines. And it was a metal sandwich, about 6 inches, 4 to 5 inches thick, that went over it, and it was all packed with asbestos. So then, because the machines are vibrating continuously as the paper comes out, there would be fine dust from the paper as well as other dust, and they would blow off these heating elements or the covers of it with air hoses to get the dust out of them. And we identified that as asbestos, which nobody knew about in the plant. They had just purchased these. And so we identified what probably was the contribution to it, worked with the company, You can see on the right side, they said, well, we're concerned. And so we helped them do a little radiographic survey, and then we moved on from that. So there's been all sorts of literature and analyses on household and other types of exposures. And you'll see here, this is from data out of 2000, just 25 years ago. A lot of literature that was then summarized with doing meta-analyses. And you can see coming up with an excess risk from household exposure to asbestos, neighborhood exposure. And unfortunately, most of these, if not all of the studies, are from European countries, Australia, because the U.S. really doesn't have adequate surveillance for mesothelioma and other sorts of issues. There's no registries. So current responsibilities, identifying disease and exposure, preventive measures we've heard about, and then the remedies for what's found. You have enforcement and compensation to individuals. And then part of the issue is safeguards for the future. And that's what the legal issues that are going on now as it relates to EPA and a ban on asbestos coming in is very important. We have a moral responsibility. One is you have scientists generating a lot of data. They publish it, but it tends not to be seen by the people who really need to know. And then we need a translation, the scientific knowledge, into industrial practice and then regulation and control. This reminds me of this cartoon, which is we generate the data over there, we store it over here, and nobody knows about it, nobody sees it. So part of what's the responsibility of this organization has been to track down that information and get it out so that people know about it and can act. Lastly, I would like to end with a memory from when I first went to medical school. Typically, doctors are first, you diagnose and you treat. That's downstream sorts of issues. Prevention issues, on the other hand, are upstream, which typically you don't hear much about. Wisconsin was very prevention-oriented. So in our Introduction to Medicine course, we had a number of books, and one of them was by René Dubois, who got the Pulitzer Prize in '69, who basically, and he's the one that said, I think it's think globally and but act locally. He's attributed with that phrase that we frequently use. And as you can read from this, the issue is that yes, treatment is important, and that, but really if we're healthier, because we've got a healthier environment that we take care of. Thank you.